you the best deal.
Now, according to a recent report by the Scientific Journal, it's estimated that Ireland is set to become Europe's most overweight nation by 2025. A symptom from this could be non-alcoholic fatty liver disease.
Which is why Paul here, the brave soldier that he is, has decided to get his liver tested live on TV. Joining us to tell us more are Caoimhe Macaulay, Director of Pharmacy and Superintendent Pharmacist at Boots Ireland, and Professor Suzanne Norris, Consultant Hepatologist. You're very welcome to the show.
Thank you. I'll jump in here first. When people think about liver, they think about alcohol. But this isn't all just to do with alcohol-related things. It could be everything to do with your lifestyle, yes?
Yeah, you're absolutely right. I think when a lot of us think about our overall health, we probably actually even overlook our liver health. And there is quite a misunderstanding out there around what actually impacts our liver health.
Yeah.
So you're spot on. When we think about liver, probably the first thing that springs to mind is alcohol.
Yeah.
But what we're less aware of is the other lifestyle choices that we make.
Yeah.
Potentially diet and exercise, and the impact that that has on our overall liver health. And I think that's why this service in Boots is so important, because it's raising awareness of our liver health. And we know that globally, incidences of liver conditions related to some of those lifestyle conditions that I've spoken about are increasing, so it's so important.
And now, with this service that Boots are offering, we see the jelly going on to Paul's stomach there. Are you all right?
Of course.
What exactly is happening here?
So what this scan does is it tells us in a snapshot 5 minutes whether this is a healthy liver with no liver damage, no scar tissue, or whether this liver has started a journey towards scar tissue that could, if it was not stopped, if it was not reversed, could lead to cirrhosis. So the normal healthy liver is really soft, spongy, kind of elastic, and would have no inflammation in it. But unfortunately, a lot of liver diseases have no symptoms until cirrhosis has evolved or established, so it's silent. And that's part of the problem then in trying to get a diagnosis, because if the person doesn't have symptoms, you know, they're not going to go looking for a diagnostic. If you can't get access to a diagnostic because waiting lists, you know what's happened with COVID, backlogs and so on. So what's really brilliant about this service is it's in your community. So you can, if you think you have a symptom of liver disease, which, you know, we can chat about, or if there's been a history of liver disease in your family, or if there's a history of things like diabetes, or, you know, the COVID stone, we've all probably had to work around that. You know, gyms were shut, people were at home working from home, eating a little bit more, maybe putting on a little bit of weight, you know, just little things, but falling into bad habits. So fat can build up into the liver. And when you have fat in the liver, for some people, it can cause the liver to become inflamed. And chronic inflammation, unfortunately, then causes scar tissue, and scar tissue leads to cirrhosis. So what's happening here is Noel has put a little bit of gel there onto the tummy. Paul has put his arm up there behind his head to open up the rib cage, because the liver sits really high up there, as you can see, under the rib cage. So what Noel is doing then is she's pressing a button on that probe, and it's putting a little shear wave, a vibration wave through the liver. So what Paul is feeling is like a mobile phone is buzzing in his pocket. It's entirely painless. It's just a little buzz that's there, and then the shear wave is propagating, running through the liver, and then the machine looks at how quickly it's getting across the liver, and that value is converted into a stiffness value. So in a healthy liver, the values should always be below 7. You know, your liver should not be inflamed, your liver should not be scarred. So once the values are below 7, then that's a healthy liver. If somebody has chronic inflammation, say they had early diabetes or something and they didn't know, then that fat in the liver will be causing the liver to slowly, silently scar up. So this is a very quick 5-minute, 10-minute scan, painless, that gives you a snapshot of whether you're good to go, nothing to worry about, or there is something going on in the background that you need to pay a little bit of attention to.
Yeah, and Suzanne, am I right in saying the liver is one of the biggest organs?
Yeah, it's a huge organ. Yeah.
And what exactly does the liver do?
So your liver is one of the busiest organs in your body. Most people don't know that it carries out about 500 different jobs every day, silently, quietly in the background, just keeping us all healthy and well. So one of the big jobs is all the blood that comes from your stomach with the food. The liver will extract out all those nutrients, proteins, carbohydrates, sugars and so on that your body needs. It also filters all the blood for things like proteins that might come from viruses or infections. So it removes all of those, neutralises them to keep us healthy and well. And then when you take a drug, the liver breaks it down to release the active drug to do what it needs to do, and then remove any parts of the prodrug that could, if it was left hanging around in your blood, cause a little problem. So the liver is really, really busy.
And something, of course, we have to look after. And Caoimhe, who would go for this sort of checkup? Like, who would you recommend? Is it all ages?
So in this particular service that we're running in Boots, we're aiming it at people who are over 18.
Yeah.
And I think, as we've kind of spoken about, we're possibly looking at people who have type 2 diabetes, or people who have a high fasting blood glucose level, people with high cholesterol, and I think the big one is as well people who are overweight or obese. And as Paul alluded to at the start, we know that actually the rates of obesity in Ireland are rising. We're going to outgrow the rest of Europe in terms of our obesity levels by 2025. Wow. So I think it's a really important one because it's silent.
Yeah.
It's really about increasing awareness. As I said, a lot of people associate this with alcohol, and that's not necessarily the case.
So there are no symptoms.
So the common symptom with a fatty liver is simply fatigue. You know, we're all tired from modern life, all the stresses in life anyway.
Yeah,
exactly.
Yeah.
So you're not going to go to a doctor and say, oh, I think I've liver disease because I'm tired. Yeah. So it doesn't really produce any symptoms until you get to cirrhosis, which is then a little bit too late. You can't reverse that. But to every step up until that, you can reverse your liver damage. Like, the liver is an amazing organ, huge reparative ability, huge ability to repair. So once you know about something, you can do something about it. So it's not something to be afraid of. It's something to actually, you know, embrace and empower yourself and learn about.
Which I think is why it's so important that we increase the early access to scanning and testing like this, because from working with Suzanne as well, I was fascinated at how reversible a lot of the early onset damage is. So really bringing something like this to community pharmacy to increase access and convenience is incredible.
It's amazing. And the cost is something that we have yet to mention. How much is this service, and is it covered on the medical card?
So the service that we're offering is a private service, and it's €200. And that involves, as you can see, a professional nurse carrying out the scan, and then Suzanne herself reading the results. And those results then come back to you within 7 days. And we're running it nationwide. So we will have these clinics in Dublin, Cork and Galway. So again, just really increasing that access and that convenience for anyone who wants to know more about their liver health.
And it's something you'd only have to do once, and then you could get it analysed and get the results.
Exactly. Yeah. So for people who perhaps have type 2 diabetes, for instance, those individuals will have fat on the liver. And so the international guidelines would say these scans should be done every 3 years, because you know that with diabetes there is fat in the liver. So it's just to keep an eye on it. For other people like Paul here, who has a perfect liver, looking at those results, absolutely pristine.
High five, Paul.
I never need it again.
Apparently my liver's in good shape.
Very good shape.
And what are we looking for?
So what we're looking at here is the red little score there, 3.5. That's your liver stiffness score. So anything under 7 is normal.
Yeah.
So that's really healthy. You've no liver damage, no scar tissue. And the blue value is how much fat in the liver, and that should always be below 250. So you have teeny amount.
170.
You're very much on the left side now.
That's a really healthy liver.
A very healthy liver.
How do we book it?
So the best way is go on to boots.ie/liver scanning. Pick your location, pick your date at a time that suits you. There'll be some pre-consultation questions that we'll ask you before you turn up for your appointment. Turn up for your appointment, you'll meet Noelle, and everything that you've seen there now will just happen.
Easy as that to check.
Easy as that.
Easy.
And like you said, it's available nationwide. Caoimhe, Macaulay and Suzanne Norris, thank you so much.
Thank you.
Thank you. Thank
Now,
you.
for more information on what we discussed, check out boots.ie/liver-scanning. Up next, we're talking fashion, so season 3.